Gerstmann's Syndrome. This is a condition that occurs when the dominant parietal lobe at the angular gyrus becomes infected. It's possible that both the superior and inferior lobes will be affected. Gerstmann's syndrome is a rare neurological condition that can emerge after a brain injury or as a result of developmental issue. Traumatic brain injury or a brain tumor in the same region of the brain might induce the symptoms of Gerstmann's syndrome in rare situations. There is no evidence that the illness runs in families. In youngsters, the cause of Gerstmann's syndrome is frequently unknown. Children who are intelligent and intellectually functioning at a high level, as well as those who have suffered brain damage, may be impacted by the disorder in exceedingly rare situations. Although it has been connected to brain impairment in certain situations, it can also affect children who do not have brain injury. Adults may develop the syndrome as a result of reduced blood supply to the brain or cerebrovascular illness, such as stroke or other brain damage. Gerstmann's syndrome affects the parietal lobe, top side lobes of the brain. The parietal lobes are involved in sensation, perception, and sensory input interpretation. How do we investigate? Like in neurological attention, we need to scan lobes to detect disease that are visible or not in a person. In finding the symptoms for Gerstmann's syndrome, we should use MRI scan to detect brain tumors, traumatic brain injury, developmental anomalies, stroke, and many more. In neurological attention, we use fMRI scan to see the image metabolic function, while in MRI scan are like three-dimensional pictures of anatomic structure. Eliciting features of Gerstmann's syndrome. Agraphia or dysgraphia. It is illegible or very poor in writing. Inconsistency in forming letters. Mixture of upper and lower case letters or print and cursory writing. Irregular letter sizes and shapes. Unfinished letters. And they struggle to use writing for communication. Achycolia or dyscalculia. This is tested by asking the patient to do serial subtraction of 7 from 100. This means 100, 93, 86, 79, 72, etc. It must be interpreted in the light of the educational level of the patient, including the age of a child. An easier test may be applicable, especially for children, and perform simple arithmetic problems. Finger agnosia. Finger agnosia is difficulty in distinguishing fingers on the hand. It is tested by requests like touch my index finger with your index finger and touch your nose with your little finger. Recognize or indicates one's own or another's finger. Left-right disorientation. This is confusion of the right and left limbs and indicates a lesion on the dominant parietal lobe. It is tested by requests like show me your left hand, touch your right foot, and touch your left ear with your right hand. A positive test is the inability to obey these commands in the presence of otherwise normal sensory and motor function. Optic ataxia. Following unilateral or bilateral lesions of the posterior parietal cortex or PPC. Optic ataxia is a cognitive disease that affects the capacity to interact with things presented in the visual modality. It means that people with Gerstmann's syndrome cannot see objects that are presented in their peripheral vision. Perceptual process. The process of selecting, organizing, and interpreting information is known as perception. Select stimuli travel via our perceptual filters, are organized into our existing structures and patterns and are then interpreted depending on the previous experiences, which Gerstmann's syndrome doesn't have and find it difficult to do those things.